Welcome to today's video, where we'll be discussing gastroenteritis, a common but often misunderstood condition that affects millions of people worldwide. By the end of this video, you'll have a comprehensive understanding of the causes, symptoms, and treatment options for this disorder. So, let's dive in. Gastroenteritis is an inflammation of the stomach and intestines, typically caused by viruses, bacteria, or parasites. Before we delve deeper into the various causes, let's take a moment to appreciate the complexity of our digestive system. Our stomach and intestines work tirelessly to break down and absorb nutrients from the food we eat, all while keeping harmful pathogens at bay. However, despite our body's best efforts, harmful microorganisms can sometimes invade the digestive system and cause gastroenteritis. The main causes of this disorder are viral infections, such as norovirus and rotavirus. Norovirus is a common cause of foodborne illness outbreaks and is often associated with contaminated food handling. Rotavirus is a leading cause of severe diarrhea in young children worldwide, and vaccination programs have been implemented in many countries to combat this virus. Other viral causes of gastroenteritis include adenovirus and astrovirus, which can also lead to acute diarrhea, particularly in children. Bacterial infections like E. coli, Salmonella, or Campylobacter can also cause gastroenteritis. These bacteria are often transmitted through contaminated food, such as undercooked meat or raw produce. In some cases, bacterial gastroenteritis can lead to more severe complications, like toxic shock syndrome or kidney failure, if left untreated. Another bacteria, Clostridium difficile, is responsible for a particularly severe form of gastroenteritis, often associated with antibiotic use and compromised immune systems. Parasitic gastroenteritis is less common but can still be a significant cause of illness, particularly in developing countries with limited access to clean water and sanitation. Giardia and Cryptosporidium are common parasites responsible for this type of gastroenteritis. Other parasites, like Entamoeba histolytica, can cause more severe infections, leading to potentially life-threatening complications if not treated promptly. It's crucial to understand the risk factors associated with gastroenteritis, which include close contact with infected individuals, consumption of contaminated food or water, and traveling to areas with poor sanitation. Environmental factors, like a lack of clean water and proper waste disposal, also contribute to the spread of gastroenteritis. Although genetic factors may play a role in susceptibility to certain types of gastroenteritis, more research is needed to confirm this. Weaker immune systems, such as those in young children, older adults, and people with chronic medical conditions, can also increase the risk of developing gastroenteritis. Now that we've covered the causes and risk factors, let's talk about the common symptoms of gastroenteritis. These can include abdominal pain, diarrhea, vomiting, fever, and dehydration. The severity of these symptoms can vary, but they often lead to discomfort and can impact daily life and overall health. In some cases, severe dehydration can result in electrolyte imbalances, which can lead to complications like kidney damage or seizures if not addressed promptly. When it comes to diagnosing gastroenteritis, healthcare providers will usually begin by taking a detailed medical history and performing a physical examination. They'll ask about recent travel, contact with sick individuals, and potential exposure to contaminated food or water. Depending on the suspected cause, additional tests like stool samples or blood tests may be required to confirm the diagnosis. In some cases, imaging studies like X-rays or CT scans may be necessary to rule out other potential causes of the symptoms, such as appendicitis or inflammatory bowel disease. For persistent or severe cases, a gastroenterologist might perform a colonoscopy or endoscopy to examine the digestive tract more thoroughly and take biopsies if needed. So, what are the treatment options for gastroenteritis? Treatment primarily focuses on managing symptoms and preventing complications. This may include staying hydrated, using over-the-counter medications to manage pain and fever, and adhering to a specific diet, such as the BRAT, bananas, rice, applesauce, toast diet, which is easy on the stomach. Oral rehydration solutions, available over the counter, can help replenish lost fluids and electrolytes. In more severe cases, prescription medications, intravenous hydration, or hospitalization may be necessary to ensure proper care. Antibiotics are generally not prescribed for viral gastroenteritis, but they may be necessary for bacterial or parasitic infections. In addition to standard treatments, lifestyle changes can help manage gastroenteritis. This includes practicing good hand hygiene, consuming safe and clean food and water, and avoiding contact with infected individuals. Regular disinfection of surfaces, particularly in public spaces or shared accommodations, can also help reduce the risk of infection. Probiotics, which are beneficial bacteria found in some foods and supplements, may also help promote a healthy balance of gut bacteria and aid in recovery. Although surgical interventions and advanced treatment options are generally not necessary for gastroenteritis, they may be required in rare cases involving severe complications or underlying conditions. For instance, if gastroenteritis leads to a severe bowel obstruction or perforation, surgery may be needed to repair the damage. In cases of C. difficile infection, a fecal microbiota transplant, FMT, may be considered to restore a healthy balance of bacteria in the gut. Preventing gastroenteritis is possible through proper hygiene and food safety practices. Regular hand washing, especially before preparing or consuming food, is crucial. Additionally, ensuring that food is stored, prepared, and cooked correctly can minimize the risk of bacterial contamination. Vaccinations, as mentioned earlier, can also play a role in prevention, particularly against rotavirus. Early detection and intervention are essential in managing gastroenteritis, as they can prevent complications and promote a faster recovery. Healthcare providers may recommend screening or monitoring for at-risk individuals, such as those traveling to areas with known outbreaks or poor sanitation. Living with gastroenteritis can be challenging, both emotionally and physically. To cope with these challenges, it's essential to seek professional help and maintain open communication with healthcare providers. There are also resources and support groups available for individuals and their families affected by gastroenteritis, which can provide valuable information and a sense of community. These support networks can offer practical tips, emotional support, and guidance to help navigate the challenges associated with the condition. It's also important to remember that gastroenteritis is usually a temporary condition, and most people recover fully with proper care and time. As we wrap up today's discussion, it's vital to remember that awareness and education about gastroenteritis are essential in managing this common disorder. A valuable tip for those affected by gastroenteritis is to gradually reintroduce solid foods into the diet, starting with easily digestible options, as the symptoms begin to improve. Drinking small amounts of clear liquids, like water or broth, can also help prevent dehydration while minimizing the risk of vomiting. We encourage you to share your experiences, questions, or suggestions for future content in the comments section below. Don't forget to like and subscribe to our channel for more informative videos on various health topics. To learn more about other digestive system disorders or any other health-related topic, please click one of the thumbnails on the screen to watch another video.